My topic today is insulin injection techniques, which is very important for all the diabetes educator present here. First of all, we'll start with the insulin. What is insulin? Insulin is a hormone made by the beta cells in pancreas, which is a key that opens the door of the cells and allows glucose to get into the cell and converts glucose into the energy. Many people with diabetes are prescribed with insulin, either because their bodies do not produce insulin, that is type 1 diabetes, or do not use insulin properly, that is type 2 diabetes. And prescription of insulin is totally prescribed by the doctors only. And we have many types of insulin available. First of all is analogs. These are laboratory grown insulin, genetically altered and either to give more rapid acting or more uniformly acting form of insulin. Some of the rapid acting insulins we have is Novorapid, Humalog, Lispro, Apidra, and many others. Ultra fast acting insulins are Fiasp. And another type of analogs are long acting insulin or basal insulin, which gives a slow and steady release of insulin, works throughout the day to control blood sugar levels in between the meals and overnight. Some of the long-acting insulins are Glargine, Detamir, that is Levemir, Basaglar. Ultra-long-acting insulins are Toujeo, Presiba, that is Degludec. Another form of insulin is conventional insulins. These are regular insulin, short-acting insulin. So some of the short-acting insulins are human actropid, human insulin R, Insugen R, and there are many other insulins, short-acting insulins available. Intermediate-acting insulins are human insulin N, that is NPH, Insulatard, and another form of intermediate-acting insulin is premixed insulin. These are combination of either rapid-acting insulin or short-acting insulin with the long-acting insulin. Mixed insulins are cloudy in appearance, and some of the example of humans premixed insulin is Novomix 30. This is a combination of rapid and long-acting insulin. Another is human insulin 3070, which is a combination of short-acting insulin and long-acting insulin. These insulin needs to be mixed before taking, which is a very important point. Needs to be taken care while injecting premixed insulin. And this is a these are the type of insulin, their brand name, onset, peak, and duration. So the rapid acting insulin, which needs to be given just 5 to 10 minutes before the meals. So Novorapid, Humalog, Lispro, Apidra. The peak time is 1 hour and the duration they work for is 3 to 4 hours. Regular insulin, that is short acting insulin, Insugen R, human actropid, human insulin R. The onset is 30 minutes, that needs to be given 20 to 30 minutes before the meal. Peak time is 2 to 3 hours and the duration is 6 hours. Intermediate insulin is human insulin N, that is NPH, Insulatard. Needs to be given before breakfast or after dinner. The peak is 4 to 12 hours and duration is 12 to 18 hours. Long-acting insulin, that is Lantus, Presiba, Levemir, Basilog, Basaglar, needs to be given at a fixed time because they works for 24 hours. So we usually give 10 p.m. after the dinner or at the bedtime. Ultra long-acting insulins are Toujeo and Presiba. This is also a long-acting insulin. The duration is almost 36 hours and also needs to be given at a fixed time. We usually give it after the dinner. Premix insulins are combination of two insulin, long-acting or short-acting or a rapid-acting insulin. So Novomix 3070, which is a combination of rapid and long-acting insulin, needs to be given 10 to 15 minutes before the meal. Peak is 1 to 4 hours and duration is 18 to 23 hours. We usually give it 2 times in a day. Human insulin 3070, which is a combination of short-acting insulin and a long-acting insulin, needs to be given 30 minutes before the meal because it has short-acting insulin and peak is 1 to 4 hours and it works for 16 to 18 hours. Both of these premixed insulins are milky in color. It's very important that we have to mix this insulin before taking. Okay, different insulin injection devices we have. there are three types of insulin injection devices we have. First is insulin pens. It can be a permanent pen or a disposable pen. Syringe and vial. It comes with two strengths, 100 international units per ml or 40 international units per ml. And the coding for these two vial or the syringe for these two syringes are 100 international unit syringe has orange color cap and 40 international unit syringe has a red color cap. So it is very important that we have to tell the patient that they have to match the strength along with the vial. If it is a 100 IU vial, they have to take 100 IU syringe, and if it is a 40 IU vial, they have to take 40 units in syringe. And the third one is insulin pumps that we are not discussing today because of a vast topic. So we have different type of needles as well that for the insulin pens. So it comes in 4 mm, 5 mm, 6 mm, 8 mm, 12 mm. But what we usually use is 4 mm, 6 mm, and 8 mm. And the size of the needle, it totally depends on the BMI of the patient. It totally depends on the fat of the patient. For 4 mm, we usually use for kids and for patients who are very lean. 5 mm or 6 mm is for normal adults, and 6 mm and 8 mm and above is for the obese patients. So after knowing the disposable pens and the permanent pen, it is very important to tell the patient how to make the pen ready. So it is when the disposable pen, when we talk about the disposable, how to assemble a disposable pen comes with pre-filled 300 units of medicine in it, and in the when the case is Studio, it has 450. That is the only disposable pen or the only insulin that has 450 units in it. Rest all other disposable pens or the cartridges have 300 units of medicine in it. So patient has to just put the right needle according to the BMI, and they can just do the priming with 2 units and they can start using the pen. When it comes to the permanent pen, how to assemble a permanent pen, cartridge, and needle. 3 things would be there. We have to open the pen, we have to load the cartridge, the prescribed insulin cartridge. We have to put the needle, and we have to do the priming with 6 to 8 units every time we load the new cartridge. Not every time before injecting or whenever we change the needle. Only once whenever we are changing the cartridge. So after loading the pen, it is important to tell the patients about the insulin injection sites. What are the sites? These sites are abdomen, arms, thighs, and buttocks. These are according to the absorption. The best absorption site is abdomen, then arms, then thighs, and buttocks. Each new injection should be about a finger's width away from the last injection. So we have to tell them about the rotation. As I have shown in the diagram, we'll start with either right side or the left side, and we give insulin for next 1 week on the same side. After completion of 1 week, we'll move to the another side so that we can give recovery time to that side. Do not give insulin if we tell the patient or we ourselves check the site of the patient where patient is going to inject the insulin. We have to, it is very important to check if that they don't have these kind of a marks like stretch marks. If it is stretch marks, the insulin absorption is not good. Scar, any surgery scar, hypertrophy, lipoatrophy, lipodystrophy, and varicose veins. So if any of these things are there, it is advisable not to take insulin there because absorption is not at all good there. How to pinch the skin correctly before taking the insulin? We have to tell the patient that they have to lift the fat only, not the muscle. So they have to lift it with 2 fingers and 1 thumb, not with 4 fingers and thumb. So they have to pinch it with 2 fingers and 1 thumb slightly. Okay. Steps of injecting insulin with the pen. First of all, we tell the patient to wash their hands properly. check the insulin name and dose prescribed before injecting the insulin from doctor's prescription. Dial the prescribed dose that doctor has prescribed, and if it is a cloudy or a premixed insulin, it is very important that they have to mix the insulin in between their palms before injecting for 10 to 15 seconds. They have to select the insulin site site of the insulin injection, that it should not have any hypertrophy, it should not have any stretch marks, it should not have any scar. And the next step is that they have to pinch the skin with 2 fingers and 1 thumb. But if the patient is using 4 mm needle, or in case of kids, they don't have to pinch the skin. And insulin injection needs to be taken at the 90 degree. But in lean patient and in kids, we can give it at 45 degrees as well. They have to press the dialer softly in one go, and after that, after the dialer reaches 0, they have to wait for 10 to 15 seconds with the needle inside the skin only, because if it take it out immediately, half of the medicine can come out with the needle. So they have to wait there for 10 to 15 seconds. After that, first take out the needle and then leave the skin. Do not rub that area. It is very important. If you rub it, your insulin will get absorbed soon. So don't have to rub. There is no blood comes out, but if there is a drop, like your needle touched any vein or something, so you can just put the needle and you can just put the cotton and you can just leave it. Do not rub that area. Steps of taking insulin with syringe and vial. First of all, they have to wash their hands, and they have to prepare the syringe. They have to wash their hand, then they have to check the insulin name and prescribe dosing before injecting. They have to check the strength of the vial, whether it is 100 IU or a 40 IU. They have to match the syringe with that. They have to match the strength of the vial and syringe. Wipe the top of the insulin vial and with the alcohol swab, and let it dry. Pull out the air. They have to take the air first, like they are prescribed with 10 units of insulin. So they have to first take the 10 units of air, and they have to put that air in the vial, and then they have to just take out the insulin in the syringe. They have to pinch the skin with the same rule. They have to pinch the skin with 2 fingers and 1 thumb. If patient is lean, they will not pinch the skin. Insulin injection it needs to be taken at the 90 degree. They have to push the plunger in one go softly. They have to wait for 10 to 15 seconds after the plunger is they pull the plunger completely. They have to first take out the needle and then release the skin. Do not rub that in. Insulin storage, how to store the insulin after buying the insulin, loading the pen, injecting the insulin. The main point is how to store the insulin, because if you not store it properly, the efficacy of the medicine can lose. So it is very important to tell the patient how to store the insulin properly to maintain the efficacy of the insulin. So all the unopened insulin vials and cartridges needs to be stored between 2 to 8 degrees temperature. They don't have to keep it in the freezer or in the chill tray. It has to be kept in the door side of the fridge. Once the opened cartridges or the vials can be kept at 27 to 28 degrees in the room temperature. But where the temperature is more than 30, they have to keep it in the door side of the fridge, and they can just take it out 15-20 minutes before injecting. And so that whenever they are taking the insulin, it should be on room temperature. It should not be cold. In hot climates where refrigeration is not possible, patients can use a cooling jar, earthen pot, or a wet clothes around the insulin to help preserve the insulin temperature. It is very important to maintain the temperature, because if you will not maintain the temperature, the color of the medicine can change or the efficacy of the medicine will lose. How to carry the insulin while traveling? This is a very common question that people usually ask. I am in the traveling job. How do I maintain the temperature? So there are many things come these days in the market. They can use a cool bag or a Frio insulin. These are pouches that comes with the coolant. You can keep it in the freezer and you can just put your pens and you can just take it along with you. It keeps your insulin pool for 7 to 8 hours. If the travel is longer than 7 to 8 hours, there is a cooling device come from the Godrej. It's called InsuliCool. It is kind of a portable fridge that we can carry. We can keep 9 vials in it, and it has a nice car adapter charger to reach it. It has on the back as well. It maintains the temperature. It has a it is a hygienic thing with the power bank as well. So you can just recharge, charge it wherever you are, or if you're traveling, or you are in a flight, or where you don't have the access to the electricity, you can use the power bank as well. The weight is also not too much. It's just 1.5 kg, and it comes with a nice belt that you can hang on your shoulder. Needle and syringe use. Ideally, one pen or a syringe should be used once, but but we say when in India, people do use it many times. It's not that economically good, so but we say you can use, but there we have to tell the patient that if you use the needle, if you reuse the needle, there are something that So needle use can contribute to the buildup of scar tissue, which may interfere with insulin absorption. So ideally, it has to be used only once, but maximum up to 2 to 3 picks we can tell, but not more than that. Otherwise, it can carry some infections as well, because all the pen needles and syringes are sterile products that are designed for a single use only, and they are no longer sterile after one use. So it is very important, if you're reusing the needle or a syringe, you have to put that cap again. So make sure that you don't throw that cap in first use only. After using the syringes, it is very important to dispose of. How to dispose of the sharp so that it won't hurt any other person. So to discard the used cartridges, needles and syringes, there is a sharp container comes in the market that you can buy, and you can put all your sharp needles, syringes, your lancets, in auto injectors and everything in that, and that it is a puncture free jar. Or if you don't want to buy a jar from the market, you can use any metal box or any puncture free jar at your home. You can just put all the sharps in it, and you can just close it tightly so that any picker will not get hurt. And every country has their own recommendation for discarding the medical waste. So it totally you can just check through it. Common mistakes while injecting insulin that we found in the patient while counseling. We do have patients who come with the very denial mode that we don't want to have the insulin, and patient who just take the counseling and they keep the paper in the file and they do not just open it to read it. So people come using same needle for a longer period of time and interchanging the same needle on different insulin. Like if patient is on the Novorapid and on the Lantus, they're interchanging the needle. They're interchanging the same needle on Novorapid and Lantus. So you have to tell the patient that we cannot do this. And ideally, one needle is for one use, but maximum we can use it up to 2 to 3 picks. So Novorapid that we're using 3 times in a day, we can change needle after second or third prick. And for Lantus, after 2 to 3 days, they have to change the needle. Injecting insulin through clothing. This is very common. People do take insulin sitting in the office from the shirt or from their clothes. So the absorption of the insulin, they will not be there. Rotating back the pen. Rotating back the pen dialer, rather pressing it while injecting. Patients don't, press it to take the insulin. They just, dial it back. So insulin will not go in that case. Their patients are using 40 IU syringe with 100 IU vial or the cartridge. There are many patients use cartridge with the syringe. So we have to tell the patient that the cartridge that we use in the pen is 100 IU and the syringe that they're using is 40. It should not be used, but if they want to use a cartridge with the syringe, they have to use the 100 units syringe with the cartridge. Patient not mixing the insulin, they are pre-mix insulin, they are injecting it like this. So it is very important to mix the insulin before injecting. Keeping insulin outside in high temperature, it will affect the efficacy of the insulin. So last but not the least, why insulin injection techniques are so important. Patient do ask us this. Now, how does it matter? I can take it anywhere. The only things that I have to inject the insulin, then why can't I take it anywhere in the body? So it is very important, and this is our take-home message as well. Like, it is important. Like, proper insulin injection technique is a prerequisite for achieving good diabetes control, because if your technique is not right, you will not be able to get good diabetes control. Rate of absorption depends on the accuracy of the injecting technique. So it is very important to take the insulin properly. If we have tell that you have to rotate the site, if you are on 4 shots of insulin, you cannot take it at the same place. You have to rotate for the good absorption. Improper insulin injection techniques, especially the rotation of injection sites and lipohypertrophy formation, is associated with uncontrolled blood glucose levels. So we see and we tell our patients and their caregivers as well to check if there is any hypertrophy where the patient is injecting the insulin. Correct insulin injection technique can reduce the hospital stay of admitted patients due to better diabetes control. So it is important for us, and it is important for patients also, to take the insulin properly. And we do take classes of our nurses as well to teach them how to give insulin properly to the patient, because it really helps in the good diabetes control in the body. Right technique and regular monitoring can help avoid serious health conditions in the diabetes. Definitely, if your diabetes is under control and you're monitoring it on the regular basis, you can avoid or you can delay the complications of diabetes. That's it. Thank you so much.
Thank you, Megha.